If you're turning 65 or on Medicare and not 100% confident you made the right choices, this is the most important video you can watch, because getting Medicare wrong can not only cost you thousands in premiums, but can also cost you thousands in penalties as well. Hi, I'm Joseph Pate, better known as Medicare Joe, and we've helped thousands of folks enroll into Medicare successfully, and each and every one of them have watched this video before making their Medicare decisions. In this video, it's a Medicare workshop that we typically run live, and it's going to walk you through key decisions that you need to understand and make before you turn 65. I recommend you watch this workshop all the way through and take notes. And if you want personalized information on your options, there's a link below that you can schedule a call with one of our team members. We'd be happy to walk you through the options that you have. So let's get into it. Hey everybody, this is Joseph Pate, better known as Medicare Joe, and welcome to our Medicare Made Simple webinar. And that is the goal of our time here today. It's to make Medicare simple, simple to understand, simple to know your options, and then of course simple to be able to take action and enroll into. We are live today, so unlike showbiz, there's no retakes or extra cuts that we can make, so hopefully there's no hiccups as we go through here today. It looks like we have about 400 attendees. I know there's still some trickling in, but we're going to go ahead and get started and really talk through a little bit of a background of what the goal of our time here today is. This is going to be about a 45-minute webinar, and through to our webinar here today, it's to alleviate any of the unknowns. In my experience, there's an old adage, you don't know what you don't know. And our webinar here today is to completely erase any of those unknowns. So that way you can make the right decision with your Medicare enrollment and not significantly, hinder yourself with financial hardships by making the wrong choices or possibly picking the wrong plan. Now, before we jump into the material for today, I want to give you a little bit of background on myself. I'm sure you're probably wondering, like, Joe, okay, this all sounds good, but who are you and why are you putting this on? So I've been in insurance now for over 10 years, believe it or not. I know it's kind of tough to see that with this baby face. A lot of people say there's no way you've been in insurance that long. But yep, I've been helping folks for over 10 years now in the insurance space, and specifically in Medicare now for over 8 years. And it all started with my grandparents. A very quick story here. My grandparents, basically, they live right up the road from me. I'm in Rhode Island, and we're a small state, and they live literally 2 minutes up the road from me. And they were getting on to Medicare, and they said, hey, you know insurance, help us figure this piece out. And I said, yeah, no problem. I can help you with it. But boy, was I in for a treat. There was all these different parts of Medicare and enrollment windows, and it took me about 6 months to a year almost of watching YouTube videos, reading the Medicare and You guidebook front to back to really get a grasp of how Medicare actually works. And then I was able to help my grandparents with their enrollment. But I said to myself, wow, there's got to be so many people out there that are like my grandparents that just have no idea how this stuff works. And at that time, basically, I completely, this is over 8 years ago now, took our resources of our insurance business and completely shifted to focusing solely on Medicare. And again, the reason I'm telling you this story is because I knew there was people that were out there that had no clue on how Medicare worked. So what we've done now, fast forward over the last 8 years, is we've been able to help thousands of Medicare beneficiaries every year now. We've grown our team to over 20 employees helping Medicare clients completely across the country. We're in every state. So please, in the chat, let us know where you're tuning in from. We'd love to hear the different cities and states that we have in our webinar here today. And again, I'm telling you all that because what I've done is I've created this 45-minute webinar that takes all of my Medicare knowledge over the last 8 years and really puts it in a simplified, easy to understand presentation. And my goal is to deliver that to you today so you can be prepared to make the best Medicare decision for yourself. Now, for everybody that's in our webinar here today, I do have a surprise that I'll be sharing at the end of our webinar. It's 2 free bonus items ultimately. And the reason that I go over that at the end is because it's not going to make any sense to you right now. And we'll get them towards the end of the webinar. And as we close out today, I also will go over the number one exposure that people face over the age of 65 that no one really is talking about during these Medicare presentations. So I'll cover that, and whether you're going to start Medicare or you're going to stay on an employer plan or a retiree program, everyone needs to be aware of that number one exposure because it is issue age based. It's about when you're turning 65. It doesn't have anything to do with actually Medicare. So as we get ready to dive on in here, I want to also note that my assistant, Tori, she's going to be answering questions within the chat for me just so I can, stay focused on the webinar that we have today. But it's made private, and that's on purpose to avoid confusion from other folks' questions perhaps. But feel free to put anything in there. She's gonna do her best to go through that and answer those. I know we have, like I said, over 400 people in here. So if your question doesn't get answered, please bear with us. You'll be able to have the opportunity to book a call at the end of our session here today and get all of your questions answered at that point. So without further ado, I want you to grab a pen and paper. You're definitely going to want to take some notes, and let's dive into the Medicare Made Simple webinar. So I always like to start with this cover page here, just so you can make note of our contact information, has our number and our website there. Should you, have to log off early, again, I know it's 45 minutes, but life gets in the way. So if for some reason you have to head out early, we can definitely get you the replay to watch on your own time. So make note of our contact information there. And I break our presentation into steps, if you will. So the steps for a successful Medicare enrollment start with stage one. And this is Medicare education, learning the ins and outs of Medicare. And that's what we're going to dive into initially here with our presentation. And the first thing to understand is the parts of Medicare. So this is the old alphabet soup of Medicare, right? So all of these parts have something to do with Medicare, but they're not all considered Medicare. So I want to break that down. Your Part A is what we would call your hospital coverage, and your Part B is your medical coverage. We're going to go into that in more detail on the next slide, but this makes up your original Medicare. So this is the traditional Medicare. And then Part C is actually another term for Medicare Advantage. This is the alternative to Medicare. Think of this as a Medicare replacement plan. And then Part D is your prescription drug coverage, which is a standalone product. So I'm going to start going over what original Medicare is, and then we're going to dive into all of these parts throughout our session here today. But to start with original Medicare and break that down for you, Part A, like I said, is your hospital coverage. So think of in-facility hospital care. As long as you've worked or your spouse has worked 40 quarters, so 10 years, you qualify for Part A at no cost to you. It's completely free for Part A. And that's going to be the case for a lot of you in here. Now, Part B, that is what we said was your medical coverage. Think of that as everything else outside of the hospital. So doctor visits, exams, x-rays, surgeries, anything that has to do with outside of the actual facility. Everything else is what I kind of sum it up as. This does have a premium associated with it. So in 2026, that monthly premium is $202.90. Now, this can differ based on your income. So I put that below. If you are filing taxes individually and your income's over $109,000 or married filing jointly and over $218,000 a year, then your Part B premium is going to be adjusted based on the income threshold that you fall into. So our team here, when you book your call, they can give you exact pricing on what that is, because we're going to go over just the standard Part B costs here today. So that's $202.90, and that's everything outside of the hospital. And when you need to enroll into this, it's going to be pretty straightforward. If you are receiving Social Security benefits already, then you're going to automatically get signed up for Part A and Part B. You're going to get your Medicare card 3 months before your 65th birth month. And that Part B premium, that $202.90 we just talked about, that's going to come right out of your Social Security check every single month before you get your distribution. Now that is, again, if you are already receiving Social Security benefits. If you are not receiving Social Security benefits and you're going to be enrolling into Medicare, which we'll talk more about in a second here, you must take action and enroll 3 months before your 65th birth month. Now, this can get done at the Social Security website, ssa.gov/benefits/Medicare. You can do it over the phone by calling them, or in person at your Social Security office. And if you're not receiving Social Security and you don't intend to, you're going to put that off maybe till 67 or 70 even, then that Part B premium can't come out of the check. So what they do is they bill you quarterly for that Part B premium. So I did the math down below. You'll get a quarterly bill in the mail for $608.70, and then you can go pay it online monthly. You can pay it, you can send a check in every quarter, but you have to actually pay that. There's nothing for them to take that out of because you're not receiving Social Security. Now, when does your Medicare actually begin? Now, of course, Medicare had to make this a little bit complicated, so it's a little different, but for most of you in here, if your day of birth in the month is from the 2nd to the 31st, your coverage will start on the 1st of your birth month. For the select few of you in here that have your birthday on the 1st of a month, your effective date of Medicare is going to start the month before. So I did a little example there. If you were born on June 1st, your actual coverage date for Medicare starts May 1, the month before. Again, for the majority of you in here, though, it'll be the 1st of your birth month. Now, the biggest question to answer early on here is, does it make sense for me to start Medicare at the age of 65? And for some of you, it's probably not going to make sense. So what I mean by that is if you or your spouse are still working and you're covered on your employer-based plan, then it might make sense for you to delay your Medicare. So if you're working and covered on an employer-based plan or your spouse's plan, you have the option to enroll into Medicare when you turn 65 and get off of the work coverage. Or you have the option to delay your Medicare enrollment until you retire. And important factors to consider there are, what are the comparative, medical costs? What is your out-of-pocket maximum at your work coverage versus what it would be on Medicare? What is the cost per month of the plan through your work coverage versus Medicare? And then also, are there any dependents, or do you have a spouse that's not 65 that is basically dependent on that group coverage, right? So these are all factors to consider to decide, does it make sense to me for me to start Medicare or for me to delay? Our team here, our agents, do a comparative analysis for you on that to really map out what the cost comparison would be and benefit comparison to compare the two. Now, regardless of if you're going to start Medicare, delay Medicare because you're on an employer plan, or you have maybe a retiree plan, those still exist. There's not many, but they're still out there. There's general healthcare exposures that at 64, regardless of your Medicare enrollment, you need to be aware of because they're age and underwritten by your health. So I like to go over those because if you're going to delay Medicare, then that's fine, but this is still stuff you need to know because you're 64, not because you're getting onto Medicare or delaying it. And the first one for these healthcare exposures that can really cost you money, hence the images there, is assisted living and home healthcare. This is the #1 healthcare exposure for folks that are over the age of 65. Long-term care, private nursing, home care. This is a study that CNBC did. Costs have obviously risen a bit since this study was done, but $108,000 a year for nursing home care, and then home care up to over $60,000 a year in costs. And a lot of this stuff, guys, is not covered by Medicare in its entirety, hence why it's the #1 healthcare exposure. 7 out of 10 people require this in their lifetime. So 70% of you in here will have this happen to you. And the reason we're talking about it, I'm going to go over it again at the end here today on how you can get that covered, is it has nothing to do with your Medicare enrollment. It has to do with your age and your health, being able to get into the products before it's too late, before your health obviously changes. And then secondly, cancer costs. So this was done by the American Cancer Society. A lot of people don't know this, some do, but most cancer costs, the majority of cancer costs that happen are actually considered non-medical. So your prescription drugs, transportation, travel, loss of income, etc. Again, this is not something that is entirely based off of Medicare. It's based off of your age. These products are for people that are turning 65 and can still qualify. 1 in 2 men are diagnosed with cancer. 1 in 3 women are diagnosed with cancer over the age of 65. So before you turn 65, they have these programs that are out there. Again, I'm going to talk more about this at the end. I want to keep today, the beginning session here, just about Medicare. And lastly, though, before I jump into the generic Medicare breakdown, if you qualify for any of the special programs listed on the screen here, CHAMP VA, TRICARE, Medicaid, VA coverage, today's webinar is going to be for folks that don't have these special programs available to them. But if you do have any of these, you qualify for a special Medicare plan, an actual special Medicare enrollment. So at the end, when you have the opportunity to book a call with one of our team members, I highly recommend you do that, because a lot of today is great for knowledge base, but for your actual plan selection, it's going to be a little bit different for what you have available than what the majority of folks on here in our webinar would have available. So I want to come back to that slide and talk about the exposures of original Medicare. So we talked about Part A and Part B, and a lot of people tell me, well, why don't I just keep Part A and Part B and do nothing else? Well, the problem with that is when you have just Part A and Part B, your Part A coverage has a $1,736 per benefit period deductible. So what that means is every time you're hospitalized, you have to pay that. It's not yearly. It's every time you go in. It's per medical event. And then Part B has the annual deductible of $283. That is for the year. But after you meet that, you have a 20% coinsurance, meaning you pay 20% of the medical bills with no out-of-pocket maximum. So for folks to carry just Part A and Part B, you'd have an unlimited liability. So it would make absolutely no sense for you to go on just A and B. And that's what leads me to what I always call the 2 roads of Medicare. Hopefully people enjoy my image there on the screen. But when I talk about the 2 roads, you need to make a decision and either go with what's called a Medicare Supplement, Medigap policy, or Medicare Advantage, Part C. You can't have them both. You need to pick one. And how they more or less map out is if you go the Medicare Supplement route, you'd have your original Medicare, so Part A and Part B. You'd have your supplement, and you'd have a prescription drug coverage. And this would be your plan in its entirety if you chose the Medicare Supplement road. If you went with Medicare Advantage, you'd have Part C, and you'd have most likely a hospital rider with it. And again, this is what we would call the alternative to original Medicare, a Medicare replacement plan. We're going to dive into that in a little bit more detail as we go through the webinar here today. So I'm going to start with going over the Medicare supplement option and dive into that a little bit deeper on how it actually works. But in its most simple form, your original Medicare Part A and Part B is going to be covering you at 80%. So basically, all of your medical bills are covered at 80%, and then your supplement plan is going to pick up the 20% gap in coverage. So what you're doing here is you're going to pay an additional monthly premium on top of your Part B payment to avoid having to pay any medical bills throughout the year. This is paying a fixed cost every month to have no variability in your medical costs. There's a lot of benefits to having a Medicare supplement plan. There's no large out-of-pocket expenses. You have the freedom to choose your doctor and hospital. There's no network, for example. There's no referrals needed. You can go see a specialist without having to get a referral. They're nationwide based, so if you are a snowbird or you do a lot of traveling, you're covered anywhere in the U.S. And they're guaranteed renewable. So what that means is that you don't actually have to renew your plan every year and pick a new one during the enrollment windows. Your plan just rolls over every single year. And with the Medicare supplement options, there's really 2 that people pick, and I've highlighted them here on the chart. This is right out of the Medicare and You guidebook. Plan G and Plan N are the 2 that people pick. And the reason why those are the 2 that people pick, if you look down the columns, they're the only 2 supplement plans that actually cover everything at 100%, which is why people buy a supplement plan. And what happens is because those 2 plans are the most commonly sold, competition helps lower the cost. So the cost of the other plans you see there that aren't highlighted actually cover less benefits and cost more money. So it wouldn't make any sense for people to choose those. And before I dive into how Plan G and Plan N work, it's important to know that the supplement plans are standardized. And what that means is that a Plan G with one carrier and a Plan G with another carrier is the same exact coverage. There's no difference between the two. The only difference between the two would be the price that they charge for the same exact plan. I know that might be hard to believe, but it's the same exact plan. Difference is the premium that they charge. So I'm going to go over Plan G first, and then we'll circle back to Plan N. But as we look down this chart here for Plan G, you'll notice everything is covered at 100% except for the Part B deductible. So how Plan G works is basically, again, in its simplest form, it's going to cover everything at the hospital. So you don't have to pay anything at the hospital when you're hospitalized. It's going to cover the full 20% gap coverage for Part B. The only thing you pay for on a Plan G is the annual deductible of $283. This is your only cost. So they consider this plan like the Cadillac coverage because you can't get any higher of a benefit. This is the highest you can go. You pay that one-time deductible for the year, and then everything after that, medical-wise, is completely covered for you at 100%. The next plan, again, is Plan N. Now, Plan N covers everything at 100%. It is missing this Part B deductible. It has Part B excess charges, that's blank. And then there's asterisks here next to the Part B coinsurance or copayment. So obviously when there's asterisks, there's usually something else that has to be had there. So I'm going to go over that with you now. Plan N, again, how this will work is it's going to cover the full Part A hospital coverage. That's going to be completely covered for you at 100%. You won't have to pay that. Your coinsurance for Part B, again, is completely covered. You won't have to pay that. So with Part B, how this one will work is you're going to pay your annual deductible just like you would on Plan G. That's $283 for the year. After that Part B deductible has been met, you'll have a $20 copay at the doctor, and you'd have up to a $50 copay at the emergency room. So again, you meet your deductible for the year, and then $20 at the doctor, $50 at the emergency room. The second part of that was the Part B excess charges. It was blank. So Part B excess charges, I always tell people this is like the most minimal variable when you're deciding between Plan G and Plan N because it doesn't happen a lot. And what Part B excess charges are is if a doctor accepts Medicare, but they don't accept Medicare assignment, which is the agreed upon cost that they're going to be able to bill for, they can charge up to 15% more than what Medicare approved amount is. Now, this doesn't apply in certain states. So if you're in those states listed there, it does not apply to you because they cannot charge excess charges in those states. And if you're not in one of those states, more than 97% of doctors in the whole US accept Medicare assignment. So you're really working with less than 3% of doctors nationwide will actually be charging excess charges. So again, the net result here is a minimal role in the two. Really, when you think about Plan G and Plan N, I'm going to get to a slide here that'll show it, and you can take a screenshot of it, is the deductible, or if you pay just the deductible and then the copays. One last thing I wanted to highlight here, again, on the chart is skilled nursing care. And this is what I was talking about earlier when I said not a lot of people are talking about this, because you'd look at this chart and you'd say, okay, well, my skilled nursing care would be covered at 100%. That's true to an extent, but that's not the whole story. So Medicare only covers you from days 1 to 20 of a stay, and then the supplement will cover you from days 21 to 100. And then after the 100 days, there's no coverage for you. So yes, you're covered at 100%, but only for up to 100 days. Again, Medicare and their guidebook doesn't do a great job addressing that and telling folks that this is an exposure. So again, this is why this is the number one healthcare exposure to people either on Medicare, on a retiree plan, or just delaying Medicare. 7 out of 10 people experience this, and those 7 out of 10 people typically are in there for more than the 100-day coverage limit with Medicare and a supplement. This is the screenshot that I said is a perfect like breakdown of what Plan G is versus what Plan N is. So take a screenshot, jot this down as a note, as I'm going to take a sip of water because I'm doing all the talking here today. And if we look at the two here, you're going to notice that the Plan G and the Plan N, again, the only difference is that Plan N has this copay for the doctor and for the ER. And because it has the copays, Plan N is usually about $30 to $40 less a month. So we typically tell people if you're going to the doctor anywhere from less than 15 to 20 times a year, Plan N could be a really good option for you to save some money. In terms of a cost, this is more or less how the cost of you being on Medicare with a supplement would look like. You'd have your Part B premium of $202.90. You'd have a Medicare supplement that's going to vary based on your zip code and your gender. So $80 to $150 if you're in some of the higher costing states like Florida, like New York, like Connecticut. And then you'd have your Part D drug plan, which would be about $15 a month, let's say. So all together, if you choose original Medicare with the supplement, you're going to be about $300 to $370 a month. And how and when to enroll? Well, we talked about Part A and Part B. That happens 3 months before your birth month. But if you're going to go the supplement route, it's important to know that this happens and can happen 6 months before your birth month. So if you are within 6 months of your birth month, you're able to lock in the rates for the supplement plan. So we typically do this one with folks first because you get the lowest prices. They don't go down, they only go up. It allows you to avoid mistakes, and it gets that first step more or less checked off your list. And then the Part D drug plan, that happens 60 days before your actual birth month. So I want to go back to the slide here again. These were your two options, your two roads of Medicare. The second one being Medicare Advantage with a hospital rider. And Medicare Advantage, I'm sure many of you have probably heard about what Medicare Advantage is, but if you haven't, how it operates is it takes your Part A, your Part B, and your Part D drug coverage, and it puts it all into a managed care organization. So you basically get one plan for everything, not multiple parts. And you're typically insured by a sole carrier with an HMO or with a PPO. This can be very similar to how you've been insured with an employer-based plan. You're going to have copays for doctor visits. You're going to have deductibles that have to be met for surgeries. You're going to have a maximum out-of-pocket for the year. Typically, these range from $5,000 to $9,000 a year. And then lastly, you're going to operate within your network of doctors. So you typically have a certain network that you got to remain in to be able to use the plan there. But there's a lot of benefits of Medicare Advantage. And one of them, the most important, is the cost. There is basically a very low or absolutely no additional premium that you'd be paying on top of your Part B of Medicare, your $202.90. Your primary care physician is typically, again, free to go see them or a very low copay. And again, they come with drug coverage, and they typically include some dental, vision, and hearing benefits as part of the plan. Now, with Medicare Advantage, there's not like a chart to show you. There's a number of different plans that are out there based on your zip code and based on the carriers available to you in your zip code. But how a Medicare Advantage plan would work, and to talk about some of the costs on an exposure level, this is a sample summary of benefits, and not to get in trouble with any carriers, we're not referencing a plan here. This is just conceptually showing you how they typically work. Your primary care doctor would be free. Your specialist would be a $35 copay. If you went to the emergency room, you're looking at a $100 copay. Again, outpatient surgery. The biggest cost here with an Advantage plan is your hospital stay is $400 a night for typically the first 5 nights of a stay. That's a per night copay. Cancer, you have a 20% coinsurance on any and all cancer treatment, chemotherapy. And then again, with skilled nursing care, unlike the supplement, once you hit day 21 with an Advantage plan, you got to pay a $200 copay every day until you hit the 100 days. And then at that point, you're on your own. Now, with Medicare Advantage, again, I always talk about the hospital coverage because this is the number one exposure with an Advantage policy. So if you had just an Advantage policy, your hospital copay is $400 a day for the first 5 days. So if we just had a 3-night stay, which is common, you're looking at a $1,200 cost for that hospital stay. Why I talk about Medicare Advantage and the hospital rider being kind of its own package is because the rider pays you $400 a day for days 1 through 5. So if you're in there for a 3-night stay, it doesn't cost you anything for that hospital stay. The best part is the hospital riders are very affordable. So if you're looking at Medicare Advantage with the hospital rider, this is going to be what your monthly cost will look like. You'd have your Part B premium, the $202.90, that still is there. And then your hospital rider is $25 a month. Again, that can vary based on your zip code, but it's important to know, everyone in here is getting onto Medicare for the first time potentially. These are guarantee issue, which means they're not health underwritten at 65. So it's important to know that if you ever want the hospital rider, the time to do it is when you're aging in because there's no health questions. Typical cost in a total premium for this, you're looking at about $230 a month if we feel the Medicare Advantage route's a better route. When to enroll? Well, when you enroll in a Medicare Advantage plan, it's going to happen 3 months before your birth month. It's going to align with that Part B enrollment. And the reason for that is you can't enroll into Medicare Advantage unless you actually have a Medicare card or Medicare number or the fact that you actually signed up for Medicare to be able to do it. Unlike the supplement, again, the supplement, that starts 6 months before your birth month. So again, this here is a good screenshot to take as I take another sip of water. That will show you the 2 roads of Medicare. You got to pick one of these 2 options when getting on to Medicare. And to quickly recap, original Medicare with the supplement, there's a lot of benefits. You can use any doctor or hospital you want to. Medicare is your primary insurance. There's no or very low out-of-pocket exposure. But there's also disadvantages. It requires you to pay an additional premium. You have to, if you want dental and vision and hearing coverage, you need to buy a private dental, vision, and hearing plan. It doesn't come with it. And then again, it doesn't include the drug coverage, which you budget for on that cost, about $15 a month. You need to add a Part D plan with original Medicare and a supplement. And then Medicare Advantage, there's a lot of benefits to Medicare Advantage with that hospital rider. There's no additional premium. It includes dental, vision, and hearing, drug coverage. It does have some extras too, over-the-counter reimbursements, gym memberships that come with the plan itself. With that, there's a lot of disadvantages as well. There's the co-payments for services, which we just addressed. You have a restricted network of doctors to work within. And again, your out-of-pocket yearly costs can range anywhere from $5,000 to $9,000 in a max. Now, this last one here that I've bulleted is very important to understand because when you're in your initial enrollment, it says may have to health qualify to get on a supplement after initial enrollment. What that means is when you first start Medicare, you can pick Medicare Advantage or pick a Medicare supplement and there's no health questions asked. You're guaranteed issued into the plan. However, if you start with Medicare Advantage and then after 12 months of being enrolled, you want to then switch to a supplement. It could be 2, 3, 4 years down the road, your health changes and you now want a supplement. Well, you now need to health qualify to get the supplement plan, which you may not be able to do if your health doesn't allow you to do it. So again, very important to know that when you're picking a plan here, this enrollment, this is the enrollment that you want to pick for potentially the life of you being on the Medicare because you might not be able to change it in the future. At this point, I want you to take a second and circle which Medicare plan you like, whether it's original Medicare with the supplement and drug plan or Medicare Advantage with the hospital rider. Because again, this is the first decision you need to make when you're getting on to Medicare. And if you're still not sure, well, at the end of our webinar, you're going to have the opportunity to schedule a call with a team member. And I strongly recommend this. Basically, during this, you'll get personal advice on your situation, and you'll get those bonus items, which I'm going to get to here in just a second. But if you're having a tough time figuring out which one's better, they can help walk through the pros and cons again with you on which one's going to be best for you in your specific Medicare situation. I want to sidebar back to the general health exposures that happen. And again, this is if you're getting onto Medicare, you're delaying Medicare, or you have a retiree plan perhaps. These are the costs that can really put people in those financial hardships that I had mentioned early on in my conversation with you here today. Again, 1 in 2 men, 1 in 3 women get diagnosed with cancer, and 67% of all cancer costs are not covered by an employer plan, Medicare, or a retiree plan. So all of our folks that we talk to that are turning 65, because it's really specific for people at 64 to do this, it's cost effective. A cancer rider helps cover this stuff. So whether, again, you're on an employer plan and you're delaying Medicare, it's advantageous to start these at 64 because of the pricing. A cancer rider pays you a lump sum, anywhere from $10,000 to $75,000 in a benefit. And the premium there, it depends on your zip code, but $25 to $100 a month, depending on how much coverage you want, can cover those out-of-pocket costs that happen when you get diagnosed with cancer. And then secondly, the number one healthcare exposure being assisted living and home healthcare costs. We went through the numbers earlier. A lot of people look to home health, to long-term care. The problem is at 64, long-term care is going to cost you about $600 a month. So it's very expensive for people to do now if they haven't already. So for people, again, that are 64, turning 65, recovery care is a great option for this. Again, regardless of if you're starting Medicare, this is just based on your age and if you can health qualify. 1 year in the home, 1 year in the facility pays out over $200,000 in benefit if you're looking for that extra coverage for this to happen. And then if you're just looking at in-home care, 1 year in the home covers you for just over $100,000. These are products that you can add now, whether you're getting onto Medicare or not, because they're issue age, number one, and they're health underwritten. So you got to qualify for them. And what I mean by that is if you delay Medicare and now you're 67 and starting Medicare and you've had some health changes, you may never be able to buy these products at that point. So again, this is for folks that are 64, regardless of what the next step is you're taking with your Medicare. The last piece I want to touch on here is the Part D drug plan. And this is going to be for folks that are on the original Medicare with the supplement side. The Part D drug plan, a lot of people ask me, well, I don't take any medication, so do I actually need to even sign up for a drug plan? And what happens is if you don't take a drug plan when you're first eligible to, and you don't have creditable coverage like through your employer, whenever you eventually enroll into one, they're going to charge you a 1% penalty for every month you didn't have coverage. So a lot of the drug plans out there now, they do have some free options or some $5 plans. It typically just makes sense that if you're not taking any medication to at least start one, to at least suffice that penalty that they can charge if you don't have one. And how the drug plans work is you have different stages. You have a deductible stage. So this is the amount that you would pay before the drug plan even covers anything. Think of this as like a yearly deductible. And then once you've satisfied your deductible, or if you're just taking generic medications, you typically go right to the initial coverage stage, which is where you just pay a small copay for your prescription drug, kind of like you're doing now. Some of them are free, some of them are like $5 to get your medications on a monthly basis. I put this next stage in here, coverage gap donut hole, because this is common for people to learn about through old videos that have been posted or old advisors that used to work within the market here. The donut hole no longer exists. It was phased out in 2025. So if you're hearing about the donut hole, it has nothing to do with you now in 2026. And then the catastrophic coverage stage has really taken the place of that. Basically, once you hit $2,100 in total out-of-pocket costs,
you pay 0% of your medications moving forward. So this is new. It was introduced in early 2025 to start the year. It used to be $2,000. It's been increased to $2,100. Once you hit that, you don't pay anything for your prescription drugs for the rest of that calendar year, and then it resets once the year is up. So how do we help with the drug plans? Basically, our drug plan research for you starts there. So we go through how to actually shop these plans and compare them. We input all your medications, we add your pharmacy, we compare all the options in your area, and we teach you how to ultimately do that, because this is something that when you get into Medicare for the first time, we shop this for you. We tell you what plan's the best one for you to pick, and then you enroll into the plan on your own. And then every year you're going to be able to reevaluate how to do this with your drug plan. So again, we show you how to do this the first time you get onto Medicare, and then typically these plans after that become direct to consumer, meaning you have to enroll in them. So the goal of us helping you through that first time is to really show you, hey, this is how you do it. We create a video so you can always reference back to that as well. And then I always like to put this slide up because we are what's called an independent broker. So we don't work specifically for an insurance carrier. We work with them all and have the opportunity to work with them all. And the reason that that's important is because when you're looking at all the different plans and carriers in your area, you want an unbiased opinion to the market. You don't want to work with what we would call a captive agent, which is someone who just works directly for a specific carrier, and that's all that they can offer you. Common questions as we kind of close out our webinar here in a bit. Do I have to pay for your services? A lot of folks come to us and say, do I have to pay for this? There's a lot of people that are in the Medicare industry that charge to do this. No, our service is completely free to you. And why that's the case is because we are paid, the company is paid via commission from carriers. So we do not double dip when we advise people and all of that. Our agents are actually paid salary here. So the people that you're talking to on the phone are there to help. They're there just to get on the phone and talk you through your options, which I think is extremely important because there's no pushy sales tactics at the end of the day. The second question we get a lot is, will the cost be less if I just go direct to an insurance carrier? And the answer there again is no. The cost is the exact same if you were to have us help you through the application process or go direct to the carrier. So the benefit of using a broker is you have a free advisor in your corner because every year things are going to change. And if you go direct to the carrier, they're not going to advise you on the market and if there's a better opportunity for you to switch to something else. And then again, we get a lot of questions about how do I know you're unbiased? Well, we work with both Medicare Advantage and Medicare Supplements. And there's a lot of people out there in the Medicare world that just work with Medicare Advantage, and they're only showing you one side of the coin. So if you're finding that you're getting, persuaded more or less into why one might be better than the other, it could be a red flag. You want to work with someone that works with both of these two roads to Medicare so they can advise you on what the best option is for your Medicare enrollment. Lastly here, I always like to throw up this slide here because we have a lot of folks that are transitioning in both their health and their wealth. A lot of people that are thinking about Medicare are also thinking about retiring soon, and they might have old 401ks that they need to have rolled over. Income planning, so if they're only receiving Social Security and they're going to need to supplement their income with retirement accounts, how much can they do per month? How long will that money last? The tax planning and the IRMA planning I put there, it's important because we talked about the Part B premium and that being $202.90 for most people in here. But if your income was over that threshold, or if you have more than $250,000 in qualified accounts, so 401k or IRA money, it's important to understand how that can eventually push you over the income limit in the future. So we do a lot of that with our clients, Roth conversions, etc. So I'd like to just throw this slide in here at the end in case people have questions about this stuff and Medicare. When you book your call, make sure you tell the agent that you're talking to that you have questions about how maybe the IRMA might be affecting you or income planning, etc. So to recap today, we went over the parts of Medicare, A, B, C, and D. We talked about the exposures of original Medicare and why that's not the best option by itself. We then led to the two roads of Medicare, having either a Medicare Supplement plan or a Medicare Advantage. We talked about when to enroll, the exposures of healthcare and ways to cover that stuff before you turn 65, regardless of if you're getting onto Medicare, the drug plan, and then lastly, why a broker is an asset. So we went over a lot here today, and I want to talk about where do I go from here? A lot of people gather all this information. Stage one was, again, Medicare education. You've either watched our other online content, you've watched our presentation today, you've maybe have watched other presentations out there. Stage two is enrollment advice, and this is where you'd be scheduling a free consultation with one of our team members. You're going to see the gold telephone just popped up in the chat area. You can book your call by clicking on that. And I'm going to explain what this is while people go and do that, because we had about 140 spots open for the calendar this week. But in that call, on that call, you're going to get 2 free bonus items. And the first one is a personalized enrollment timeline. So this is what you need to do and when you need to do it for your specific enrollment. And then the second is a Medicare cost summary, which is basically a breakdown of what Medicare is going to cost you on a monthly basis for the specific options that you have picked and you want to actually enroll in. And again, that call's free to you. Our agents, again, are happy to help and assist you through that and what makes the most sense for you. So go ahead and start booking that on the phone. I'm going to go over stage 3 here, which is often overlooked, but is probably the most important. Stage 3 is what we would call lifetime support. And what we do here is not transactional. We don't just help people get onto Medicare. We help them through the life of being on Medicare. And what I mean by that is as questions come up, claims happen, rate increases happen, you need a new ID card, whatever it might be. We have a fully staffed customer service team that is every day answering our clients' questions. Instead of you having to call the carrier and deal with all the hold times and that stuff, you can reach out to our customer service team and ask them any questions that you have about your coverage. And then lastly is free annual reviews. So on the anniversary of your policy, and every year these plans change, they go up in premium sometimes. They're adjusted for the benefits. So what we do every year is on the anniversary of your policy, we're shopping and ensuring that you're paying the best rate for your coverage that you have. Again, often overlooked, but probably the most important stage of your Medicare enrollment is not just getting onto it, but what happens after I get onto Medicare and what does that look like?
So if you're turning 65 or about to be starting Medicare for the first time and you want to make sure you're doing everything correctly, there is a link below in the description. You can book a call with our team member. We will walk you through your personalized situation and make sure that you are making all of the right decisions with your enrollment. But if you're still in that research phase, certainly click that red subscribe button. What that'll do is that'll notify you anytime we're posting new Medicare information to our channel, because we post weekly on this channel to help people avoid any Medicare mistakes. Again, thanks for watching.